Hello and a very good evening to all. I am Dr. Ronak Gandhi. I am working as Assistant Professor in the Department of Endocrinology at Dr. SN Medical College, Jodhpur. I welcome you all to this Endocrine Society of India Facebook Live session and thank you everyone to join in for the session. At the outset, I would like to thank Team ESI and Dr. Rakesh Sahai sir for providing me with an opportunity to be a part of this endocrine awareness program. So the Endocrine Society of India, it is the largest association of endocrinologists in India. We have been conducting these sessions of Facebook Live sessions for the purpose of awareness among the general public about the endocrine diseases. These sessions are done on every Saturday, usually evening 4:30 p.m. starts the starting time. They are covering different endocrine topics each month. For this month, the month of September, we have a different topic, and the topic is men's health. So, for men's health, and today's session or the discussion on the topic regarding men's health will be about the fertility problems in men. So, to join us in this awareness session, we have three eminent panelists. So, let me introduce these panelists. First, we have Dr. Arpandev Bhattacharya sir. Sir is consultant in Department of Diabetes and Endocrinology from Manipal Hospitals, Bangalore, and Professor of Endocrinology at JJM Medical College, Davangere, Karnataka, and he is also co-chair at Shivjyoti Clinic, Bangalore. I welcome you, sir.
You.
Next, we have Dr. Balram Sharma, sir. He is professor and consultant endocrinologist in SMS Medical College, Jaipur, Rajasthan. Welcome you, sir.
Thank you, Ronak, and good
And
afternoon,
then we
everybody.
have a reproductive medicine specialist, Dr. Raju Nair, sir. He is director and head of reproductive medicine, Mittreya Hospital, Kottayam, Kerala. Welcome,
Yeah,
Raju, sir.
thank you. Thank you.
As we are about to discuss a medical topic here with these eminent panelists, these eminent endocrinologists of India, I would like to have a disclaimer about the topic that is going to be discussed, that there might be use of some medical terminologies which will be with respect to reproductive medicine specifically, which will be used for just for the purpose of the awareness of the general public, general masses, and regarding the fertility aspects. These are not intended to mean otherwise than the sole purpose of educating or providing awareness among the general public about this endocrine aspect. So, before we engage into the aspects of problems of fertility in men, I would humbly request Dr. Arpandev Bhattacharya sir for his opening statement about the infertility issues in men. Over to you, sir.
Thank you. Thanks, Dr. Ronak. Good evening, everybody who is connected to us. I'm very glad that you have taken an initiative to do this. From our joining of the medical family, so probably now 41, 42 years back, I have joined after finishing my class 12. So one thing is very clear, over the decades we are seeing that whenever there is some problem of conception comes, it is always a female partner problem. We never accept. We always think the men are the best. I know it's all right. Men are good, not that men are bad. But we need to think of that in infertility is a problem with a couple. It's not that the woman husband is getting the baby or the wife is getting, but they are getting the baby together. So we need to get both of them right, and for that, choosing a topic like a male fertility is actually wonderful. So I hope in today's discussion we'll highlight for public some of the issues that male fertility are important, and then where to find the defect and what is the easiest way to solve the problems. Ultimately, we are successful. Thank you. Back to you, Ronak.
Thank you, sir. Thank you very much. So, in this session, we are going to discuss about the various aspects of male infertility and the fertility problems that can arise in men. We can also have the questions from viewers. So viewers who have logged in through the Facebook, watching the Facebook live program, They can type in their question into the comment box which is there, and then with these questions can be taken up. So to begin with, I would like to have your opinion, Balram sir, that what is the criteria to say that a man is having fertility problem definitively?
Okay. So thank you, Ronak. So as introduced by Dr. Arpande Bhattacharya sir, that anyone can have the problems. In our society, we frequently see that whenever any couple is not able to conceive, the first evaluation is almost always is being done with the females. But the story is not that. The contribution by the any partner, means either the male partner or female partner, is nearly 50%, we can say. So nearly for 50% reasons the male might be responsible, for another 50% the female factors might be responsible. But how we can define and how and whom and when they should consult a clinician or endocrinologist, this is very important to know. So those whosoever are listening our program or we are watching our program, they are for themselves and they are near and dear. If any couple who is living together and they are in the reproductive age group and they are having regular marital relationship, we are avoiding those terminologies just for the Facebook live reasons. But if they are having regular marital relationship for at least a period of 12 months, and that also in unprotected manner, means they are not using any oral contraceptive pills or any other barrier methods they are not using, and even after 12 months of frequent marital relations, if they are not able to conceive or if they are not able to become parent, then definitely this is a matter for evaluation. And we should not forget that there are lot of taboos in the society, there are a lot of inhibitions in the society, and most of the time the couples, particularly the males, are hesitant in getting the opinion, but they shouldn't. If the things are like that, then they should consult a clinician. Ronak.
Thank you, sir. Thank you very much for that elaborative definition or the elaboration part. Uh, I would like to have an opinion from Raju Nair, sir. Sir, the fertility problems related to men are seldomly heard. We rarely hear about a man who is considered to be the part where he or the infertile couple is there, and then we found out that the male is responsible. This is seldomly heard. Is it that common in India even, sir, or is it just a Western thing, or that kind of perception is there?
Thank you, Ronak. It's an interesting question because just follow what Dr. Balram has said. Because we know the infertility is a growing concern, and very honestly, 50% or even more is actually due to male factor infertility. So male factor is a seldom known factor. That concept is entirely wrong. Because whenever a couple is coming for an infertility evaluation, as a dictum, the first test to be done is semen analysis. Because, and majority of time, I should say close to 50% of the time, there can be some changes with this analysis. So a problem due to male factor is actually proportionately is on the rise. And if you look at a last 10-year data, definitely you might have seen in many magazines like Times, The Week, India Today, whatever be the magazines, there are all articles pertaining to this aspect. That means the male infertility is on the rise, and the reason behind is most probably the lifestyle changes that the present day males is actually facing. Definitely, male factor is definitely on the rise, and that is attributed to more than 50% of the cause of infertility.
Thank you, sir. Thank you. Arpan, sir, can we have a comment from your side on the common causes, sir, that can decrease the fertility in males?
Well, that's important because we are here to sort out the male fertility problem. Now, actually, there can be a lot of causes are there. So, important thing we need to remember that one is the local cause. Okay, one is a systemic. Systemic means different reason, different illness that may make a problem with the male fertility. And then one is the center part from the brain or the pituitary gland. I will come to that. So if I pick up the first one, which is the local cause, that means the problem is there in the testis. Okay. So So it can be so many things. It can be some infection in the childhood, like a mumps is one of the infection is very, very important for us to remember. For example, there is some trauma during playing in the childhood. The testicles have got damaged, so they are not producing adequate amount of sperm for fertility. Or some childhood a significant illness for which some therapy given. I'm talking about some chemotherapy, radiotherapy type of illness going on. Other than that, itself in the testis, there can be problem with the sperm production, and that can certainly cause the male fertility problem. Nonetheless, systemic disorder like a significant liver disorder, significant kidney disorders, generalized malnutrition, systemic infection like a disseminated tuberculosis can cause male fertility problem. And lastly, not to forget, to have the whole cycle going on, we have a pituitary gland just below the brain, which stimulate the testis for production of two things. One is the hormone, which we call testosterone. Another is the sperm. So if the pituitary gland or any problem here is not taking the control of the testis, obviously your sperm count will be less and you will have some problem with the fertility. So whenever I'm seeing the people, I'll be thinking in these three main heading, and mostly more than 90% of the cases will be quickly evident if I follow a systematic approach. Yes, Ronak.
Thank you. Thank you, sir. Thank you, sir. So, next I would like to have comment from Balram sir. Sir, what are the systemic or the generalized diseases in our body that can cause fertility problems in men, that other diseases or any other disease that is pre-existing in the body and can have its effect on the fertility in males?
Yes. So that is very relevant question, Ronak. Actually, any fertility aspects can be normalized only in a normal, healthy body, healthy endocrine system, and healthy mind. So if somebody is having severe diseases, chronic infections, chronic malnutritions, I will discuss some things also in coming few minutes. If a person is suffering from those, then definitely the fertility might be negatively impaired, because the survival is most important. So if somebody is critically sick, like chronic diseases, Dr. Arpandev has just mentioned about the chronic diseases like prolonged uncontrolled diabetes with various complications, if that is there, if any chronic kidney disease is there, if chronic liver disease, a lot of cirrhosis patient, alcoholic patients are there, chronic malnutrition, severe anemias like thalassemia patients, sometimes the sickle cell anemia patients, various infections like HIV infections with various complications, hepatitis infections with various complications, and rightly mentioned by Dr. Arpandev about the mumps. Mumps is very, very common entity which might be there at any age of time, particularly in the childhood, but later on that can lead to the infertility because of the defective production of the various factors responsible for fertility at the level of testis. If somebody is having other chronic issues like chronic head injuries, chronic surgeries, he has been operated for some head injuries sort of, or some brain tumors or other cancers, or any other cancers, they can also lead to the infertility, not only because of the disease itself, but also because of the various treatment options we will be discussing in coming few minutes. So they are very, very important. The normal endocrine function is also very relevant, as mentioned by Dr. Arpandev, that normal pituitary gland, which we know as the master gland, that is a master regulator of all hormone secretion in the body. So if there is defect at pituitary level, or even above that, like at brain hypothalamus level, then the normal hormone function will not be there. Then the problem might also be reflected in the manner of fertility issues in the males and in female both. Ronak.
Thank you, sir. Thank you very much, sir. So our lifestyle has changed a lot, and we are seeing a much of addictive substance abuses on the rise in our lifestyles. In population-wise, if we see, there are a lot of people who are consuming the substances that can make them addictive, that can make them dependent on the addictions and these kind of things. So I will like to have a comment from or highlight Raju sir. Can you please highlight the role of these addictions or these addictive substances abuse rather, which can affect the fertility in men?
Basically, if you look into the lifestyle changes which is actually happening in the male factor infertility, that attribute to the so-called idiopathic. That means we cannot definitely say this is an organic pathology, but the lifestyle is actually contributing to this. So, to highlight the most common or rather the most notorious smoking, because tobacco chewing, smoking, anything which is related to tobacco can definitely alter the sperm quality and function. So I like to highlight the point function because when we look at the quality of sperm, is not just the ability to fertilize and oocyte. It is about the quality, the DNA integrity of the sperm. So by having a lot of tobacco or other injurious, which is injurious to your health, which is taking in a substantial amount, that will actually deteriorate the entire structure of this, the nucleic acid, and thereby entire structure of this sperm. So you are facing a much bigger problem that you actually see. That is why we usually see the semen analysis is actually the tip of the iceberg, because by routine analysis we are just seeing just the basic things, but the gravity of the situation is much more worse than we actually see. So anything related to tobacco is the number one killer, and second most is alcohol. Alcohol in moderation will definitely hamper the quality of sperm. And third, most important, or rather the pandemic of the society or the century is obesity. Because when there is high morbidly obesity levels are on the rise. So when there is obesity, it will definitely affect his maleness, especially affect his testosterone production and affect his sexual function, and there can be hampering in the spermatogenetic production. So three things: smoking, alcohol, and obesity are the major culprits of lifestyle changes which can lead to male factor infertility. And adding to this, I will highlight two important things about the usage of these laptops and mobiles very close to the inner pants of pant pocket, because there is substantial studies has proved and which has published in international journals that the side effect of all these electromagnetic waves, which is closely in relation to the testicles, which can damage the sperm quality and thereby progressing into male factor infertility by decreasing the count and quality of the sperm. So these are the main lifestyle changes or lifestyle diseases that can have a negative impact or rather the problem of causing a male factor infertility. Right.
Sir, I would like to have a comment or highlight. Can we highlight the role of anti-cancer medicines, because there is the rise of cancer in every broad aspectly speaking, every organ of the body. There is a cancer, and the incidence of these cancers, the diagnostics have improved rather, and we are picking up cancers very early. So patients are a lot. The patients are on anti-cancer medications, so can these anti-cancer medicines can also affect the fertility, Balram sir?
Yes, correct. So this is very relevant question. We know that in every part of world, including India, the number of cancer patients are rising, and that too more important, the in the children's as well in the other adults who are in the reproductive age, because we know that now because of the availability of various cancer chemotherapy options or therapeutic options like chemotherapies, radiotherapies, and other treatment modalities, the survival of cancer patient has increased significantly. And now the problems of fertility issues post chemotherapy, post radiotherapy, cancer survival patient is on rise because of various reasons. The actual factor which is responsible is that cancer chemotherapy or radiotherapy actually tries to kill those cells who are rapidly increasing in numbers or proliferating, and the same is happening in the genitalia or in the gonads. So whenever somebody or the children or the adults who are in the reproductive age group or they are going or entering into that age group, if they are being treated with chemotherapy or radiotherapy, sometime that can impact temporarily, means temporarily infertility issues might be there, and many time that can lead to the permanent fertility problems. So these radiotherapies or chemotherapies and various other treatment modalities of cancer can negatively impact the fertility aspects of male as well the females. But as we are discussing in the males, so one has to be very particular when they are opting or when they are being subjected to the chemotherapy therapeutic options, and if they are willing to become father in coming years or future, then there are various options of sperm preservations that can be used, and in the future they can use those cryo preserved, means the sperms are being preserved in the very low temperatures, and that is easily available now in almost every part of our country also, and that can be used to preserve the fertility in the future for these kind of patients. So that is very, very important to know, and I think that will help to increase the awareness in our audience today. Ronak.
Thank you, sir. Uh, Arpan Dev, sir, whenever an infertile couple comes to your clinic regarding the decreased fertility among the couple, uh, what are the usual investigations or what are the usual tests that they need to undergo for the evaluation of the male factor or the problems with fertility? We are suspecting the problems with fertility in men. And what are the usual tests or investigations that are done? Can we have a brief overview, sir?
Right. Yes. Thanks very much. It's for a while I was thinking of my MBBS days where teacher used to tell whenever you are telling that first investigation should be for the male, and the first investigation after you have taken a bit of history and doing a little examination has to be a semen analysis for the sperm count. So at the end of the day, the sperm count has to be above the critical count. It used to be 20 million. Now we are telling 15 million, and some guideline tells that more than 12 million is actually can be okay. And then two more things in this we need to see about the quality other than the quantity. That is the number, quality, and any feature of infection is there or not. There are a lot of other things can be tested, but that's not for general thing. But commonly we will be seeing the count, the quality, and any infection feature is there or not, which can be in terms of some pus cell, and that can be easily treated. Once you have gone through this, then we need a bit of a quick hormonal assay. Hormonal assay will mean the hormone, which is the male hormone, that is called androgen or testosterone. We'll check in a blood sample, which is a simple and reasonably cheap test. And also the pituitary gland I was mentioning before, it stimulates, that gives some hormone. And these are the three names are important. One is LH, one is FSH, and one is prolactin. Because all these can find out which level I am having the defect. One is that doing the sperm count, which is the final common output part. One is the testicular function for the hormone production, and one is the control. Other than that, so far the investigation is concerned, we'll be seeing you general. We have spoken about this long-standing uncontrolled diabetes, malnutrition, or liver function test, kidney function test, and so on, other disorders. Yeah, over to you,
Thank
Ronak.
you, sir. Thank you. Thank you, sir. Thank you, sir. That was an elaborative answer, sir. Actually, I also drifted into my MBBS days when I have read all about these things. Sir, Raju Nair, sir, can we please elaborate on the precautions to be taken by the patient before attempting for a sperm collection? As we have talked about the semen analysis, which is primarily used for the collection of the sperm semen. So, can we have an elaboration about that? What precautions the person should be taking while giving for the sample?
Yeah, there are many things to be looked into before giving this test. Basically, depending on this test, we are making a lot of decisions based on this test. So, first of all, the lab which you are going to give, because there should be a dedicated andrology person who are well versed in doing semen analysis should be there, because majority of the laboratories doesn't have that facility. So the place where you're giving the sample is a very crucial thing. Second, how you collect, because if you have just 1 day abstinence and give the sample, or suppose if you have a 1 week abstinence and giving the sample, obviously this will have some errors in the total count. Optimum time frame or optimum days of abstinence before you giving the sample. This optimum time frame is either 3 to 7 days. That means it should not be less than 3 days or more than 7 days. So there should be a gap of 3 to 7 days before giving out the sample. And second thing, try to give the sample within the laboratory itself. Because if you have a home collection and then transporting the sample back to the lab, then you should be very careful in collecting in a very sterile container that with a wide mouth model, because the entire collection should be collected properly, and that should be transported to the lab with a span of 30 minutes to 1 hour time. So usually this can have some negative effect. So if possible, you try to collect the sample in the lab itself, where there will be a separate room or a collection room should be available, not in the toilet or somewhere. And the container which is collected is actually the one which is a sterile container provided by the lab. Majority of the time we see the people will taking part some small depot and collecting the samples, which is actually which will give you a negative effect on the microscopic examination. So it should be a sterile container and should be a wide bore mouth, so that the entire ejaculate should be collected into the container. So these are the basic three things that should be aware before venturing out into this analysis. Over to you, Ronak.
Thank you, sir, for that nice answer. Where we can, because the semen analysis or the sperm count makes the first part of the examination that has to be done very correctly by the patient whosoever attempts for it. Sir Balram, sir, can I have importance of the Barpan Dev sir has already discussed about the major investigation. So male hormones are also forming a big part for that LH, FSH, prolactin. So can you enlighten us more about the hormones, the roles of the hormones in the fertility, how they affect the male fertility, sir? Please.
Yes, that is very important to know and discuss. So as we started with in the initial part of this discussion, that there are various levels at which there are governing centers of hormone secretion. So there are basically hypothalamus in the brain, then pituitary, which is master regulator or master gland, which is actually controlling almost every hormone secretion or major hormone secretion in the body. And then comes the gonads. So gonads, either in the male or female, both are the secretion of gonadal hormones like testosterone in male or estrogen in female are being governed by the pituitary. And as Dr. Arpandev mentioned about the LH and FSH, so they are the regulator. So there are few hormones like LH and FSH. They are regulating the normal hormone secretion both in male and female, while few hormones are actually, if they are in increase in the levels like prolactin, they can negatively impact the gonadal health. Sometimes the chronic hypothyroid state or chronic hyperthyroid state, if they are uncontrolled, they may also negatively impact the hormonal health. So the normal hormone milieu is really very important. So not only the normal level is required, but the abnormally high level of some hormones may also be negatively impacting or influencing the gonadal health. If the pituitary health is okay, then the gonads like testicles in the male has to be normal, and they should be secreting normal testosterone, because normal testosterone are required for normal sexual health of a male, normal fertility aspects, including the normal sperm production from the testicles, because only in the normal testosterone environment the germ cells from the testes are actually producing normal sperms. So that is also very, very important. At the same time, the normal testosterone is also responsible for normal maleness of the male, like normal male health, as well the behavior between the two partners, like the for a normal marital relationship. Normal testosterone level is also required for normal libido and maintenance of the normal sexual health. So this hormone is extremely important, and if the level is not there, then definitely the fertility and the other aspects will be negatively impacted or influenced. Romit.
Thank you, sir. So, sir, I would like to have a word from Arpan Dev, sir. Sir, there we have already explained about two levels where the control is there. The pituitary control from where the LHFSH is there, and from the testicles or the gonads from where we are having the testosterone. So, can we have a word from the pituitary defects, what that cause the testosterone deficiency, and what is the testosterone deficiency by itself, which we, as in our medical terms, we usually called as primary testicular failure, the most common being the Klinefelter syndrome. or the central defect with the pituitary defects are there. So can we have a bit of elaboration on these two terms or these two topics of having low testosterone because of these two causes?
Right. Okay. Just taking the clue from Dr. Balaram. So, testes has two functions. One is production of the hormone, and one is the production of the sperm. So, for this, if the pituitary gland gives us two hormone, LH and FSH, to control this. Okay. Now, if the defect is in the pituitary gland, which means the pituitary hormones are not stimulating. So, we have an option that we can give these two hormones as a treatment. Unfortunately, they are injectable treatment. Unfortunately, they have to given at least 3 times in a week. But it is very important that if we find the problem is here and we decide to give the injection, we can give a course of injection. It may require around 12 months to 18 months to slowly build up the sperm count. And that is certainly a big option. A little costly, but certainly a clear option. Now, if the problem is in the gonad, in the testicle, as you told, the primary testicular failure, obviously your giving you the pituitary hormones will not cause anything. The defect is there. So we need to do something depending on the etiology of the defect, why the defect is there. We need to take the action. Thanks, Sonak.
Sir, thank you, sir. Thank you, sir. Sir, we have entered into the part where we are discussing about the management. Sir, Balram, sir, can we have a brief overview about the male infertility management? How do we manage these kind of cases where the problems or the defect lies with the male counterpart and we have to sort it out? What are the management options we have?
Yeah. So whenever we are discussing, like in this program, until the management is being discussed, nothing is actually useful to the patients or to the audience. So whenever we are discussing about the management or somebody who is willing to get the management, at the patient's level, the first and foremost thing is that please leave your inhibitions behind and come forward and discuss with your clinician, and particularly if that is possible, preferably an endocrinologist. That is most important part. Because of taboos, because of social inhibitions, and because of other factors, males are actually trying to conceal the things. They are not revealing the issues, and that's why they are getting delayed in the diagnosis, and sometimes the precious time is actually left behind. And even if we are able to help him properly, sometimes the proper time is actually not being utilized. So that is very, very important. Once the patient is there with the endocrinologist or any clinician, then the first and foremost is the detailed history, just to reach a conclusion that either the patient is having the psychological issues, the other issues, or really the fertility issues. And as we have discussed, that there are various investigation available by which we can actually decide that where is actually the problem. So if the problem might be at the level of pituitary, as we are already discussing, the problem might be at the level of testicles. The problem at the level of testicles might be in two manners. One, the testes are actually not being developed because the pituitary is problematic. So by the stimulating hormones like LH and FSH, as Dr. Arpande just mentioned, with regular treatment and follow-up, we can actually help these kind of patient, and a significant number of patients can get good results also in a due course of time. Although that is a costly affair, but still the fertility aspects can be achieved. The second is that the testicles themselves are defective. Pituitary is okay, but the testicles are problematic, means they are not forming the sperms. So the treatment options are limited, but there are treatment modalities now available called as artificial insemination techniques or the assisted reproductive technique, ART technique, where they can try to retrieve few sperm which are left there in the testicle, and that can be used for the assisted reproductive technique or ICSI sort of techniques that can be utilized. The third factor is the obstructive issues. Sometimes there are obstructions only, means in the testicles the formation of sperms is there, but they are not coming out at the time of marital relationship, and that might be also the reason. And there are now the microsurgical techniques which are available, and they can actually helpful in removing the blockade, and these kind of patient can get or can achieve the fertility, and they can become the parent. So these are those. Then coming the other issues, like if somebody is having chronic disease, then we should try to improve the chronic disease. If somebody is having chronic infection, then we should try to focus on that particular aspect. If somebody is having malnutrition, then also we should try to improve that until we are not able to achieve the fertility, because the basic or root cause is actually in the systemic disease, as we are already discussing about those causes. So we have to reach to a proper conclusion that what is the actual cause or etiology of that particular problem, and then accordingly we can treat, and a good number of patient or significant number of patient we can achieve a good results also. So there is a hope, dear colleagues and audience. If you are getting a proper consultation at a proper time, then you can get the good results. Ronak.
Thank you, sir. Thank you very much, sir. Raju Nair, sir, Baldev sir has, the Balram sir has just touched about the topic of artificial reproductive techniques. We usually heard for in vitro fertilization or saving of eggs for female. Can there be these kind of techniques, use of technology for the male part infertility, where we can have this ART techniques for the males, solely for the males? Are there anything technologically, sir?
No, basically, if you look into ART or assisted reproductive technology, it is not that meant for girls, ladies, or men. It's basically for the couple. It is basically for an indication. So, suppose if you have fundamentally there is only three treatments in modern medicine for infertility. One is something called timed intercourse. Second is called intrauterine insemination, that is depositing the sperm into the womb. And third is IVF or ICSI, that means test tube baby. So, which couple needs either of these three treatments is actually denoted by one of the major important factors, the seven analysis. From the seven analysis, as the doctors identify an entity called total motile factor. That means of the total count, how many sperms are actually viable. So depending on that, we have to decide which treatment actually decided for which individual. And suppose if you haven't have barring the normal episode pertaining to assisted reproductive technology per se, we have intrauterine insemination. That is, we are collecting the spermatozoa, improving the motility by adding some culture media and doing a semen wash and putting it back to the uterine womb. Is a fairly simple and a very cost-effective option for mild male factor infertility. That means those patients with a slightly less count of motility, and the cost is also not very exorbitantly high. And the second, or rather more specific treatment for male factor infertility is called ICSI, or intracytoplasmic sperm injection. Here what we do is that into an oocyte, we are actually injecting one spermatozoa into the egg. So the process of fertilization, that means the fusion of egg and sperm, is actually happening within the lab under the help of a microscope. So this is the definitive treatment for male factor infertility. And since I think it was 1994, this ICSI scientific technology has evolved. Actually, that has revolutionized the concept of male factor infertility. That before 94, if an individual have got suppose a count of 2 million or 3 million, modern medicine have much of a role to play, because it's nothing much treatment which could be offered. So now, even suppose this ejaculate doesn't contain any sperms, we have the option of sperm from its testicles, either by a simple aspiration, or as Dr. Balram said, it's called a dissection of the sperm by a sperm retraction. So there are many methodologies we can retrieve spermatozoa. So if you are able to achieve, say, 3 or 4 spermatozoa out of an individual, that is more than sufficient to transfer this genetic material into an oocyte and get an embryo out of it. So in modern medicine, the male factor infertility treatment is actually has gone too high. So even if we have very less number of sperms, with the advent of ART and the specific treatment called ICSI, intracytoplasmic sperm injection, we can actually do wonders in terms of male factor infertility. How would you?
Sir, Balram, sir, there is always a psychological impact whatever disease a person is suffering from, even be the systemic diseases or the person is having some other diseases, local diseases, even there will be a short span, even with local diseases, short span, or a systemic diseases, very long duration of psychiatric manifestations or psychological support we need. So, sir, how the psychological or the psychiatric part of our body is going to affect the fertility, sir? It is going to decrease, or when we have the disease, when then it is going to affect the disease, or how can we provide for the psychological support to the patients, the psychological aspect of infertility in men? So, can we have just a few words from your side, sir?
Yeah, of course. So any disease can impact you psychologically negatively, or that can lead to depression. That depends upon the family support, the clinical support. And here in this particular entity, this is more important because sometimes the patient is not actually able to explain the things to the family members. And here comes the role of clinician as well the partner. If we are discussing about male infertility and psychological issues, then we should take the female partner like wife in confidence that most of the things can be treatable easily and we can get a good results with proper treatment. So we should try to focus on the treatment strategies and we should discuss one by one with each other, because sometimes there is hesitation between husband and wife also, because there is a male factor, and that sometimes even the male is not discussing with his wife also. So we have to discuss separately. Then we should try to make them confident, and we should increase the confidence in the treatment and investigation, that various options are available as we are just discussing about various etiologies or causes. And if nothing is there, then adoption can be tried. So that is also legally available in our country. And if required, and if we are seeing that depression is significant, then we can take the help of psychiatrist also. So there are various options available. But this is really important aspect, and we should try to tackle this. Ronak.
Sir, thank you, sir. Sir, there are some of surgical manifestations or surgical part where they have seen that varicocele or enlargement of the venous part complexes within the scrotal part or the lower genitalia part can also cause infertility. So that is such kind of a problem, sir. I would like to have a comment from or Dr. Arpandev Bhattacharya, sir, can highlight that issue, sir.
Right, Dr. Ronak. So basically, you are talking about a condition called varicocele, which means that if I just explain that for a bit of a general information wise. So normally, when the blood comes out of the heart, this is in the high pressure with the artery. And then when you go back, it is a low pressure called the vein. So whenever you go low pressure back, you need some steps to hold it back. And that's the reason nature has given something called valves. So inside the veins, there are some valves are there. So the step by step blood can go back. Now in varicocele, what happens? The venous plexus or the venous areas or the drainage areas of the testicle, the valves a bit of a get destroyed. So automatically, because of the gravity, more blood comes down and it gets accumulated in the scrotal whole sac area. Now this can do two things. One, temperature goes up. Now, if the temperature goes up, it can have a problem in the sperm production. Number two, because of the mechanical pressure, it can create a problem with the sperm production. Now, these things have been sort of documented, proved, and being treated. So, what you can do for the treatment, basically, this is surgical correction. Their success rate is good, so that varicocele can be treated. But the fact is that if you see the literature for last 20-25 years, there is some improvement you can expect about the sperm count after varicocele, unless it's a very huge varicocele, but not a great expect of benefit is there. So if somebody diagnosed a varicocele, which is actually is a reasonably common condition, we should not be probably going jumping with the comment that I need to do immediate surgery so my sperm count will increase and the fertility issue is gone. So we need to take a bit of a stepwise approach, a bit of a slowly understanding the and expecting the correct expectation, because if you expect too much, you will be unsatisfied.
Thank you, sir. Thank you very much, sir. Sir, there is a trend, then Rajunaya, sir, that is for your kind opinion, sir. So there is a trend that people happen to have sterilization. There is a common trend when vasectomies are easy and people try to have vasectomies. because of the birth of two child or three child, they feel that they are satisfied with that population, and then something happens, and then they want that their fertility be restored. The male wants their fertility be restored. Is this possible, sir, and how feasible it is for a couple to have, or the men to have their permanent sterilization be reversed?
Yeah. Previously, from the Sanjay Gandhi days onwards, we are facing this problem of vasectomy and the vasectomy success, because vas difference is a small tube which actually connect from the testicles to the pipe where the urine also coming. So when this tube is cut, obviously this connection is lost. So by theoretical possibility, if you reconnect this vas together, there is a possibility of regaining it back to the normality. But the success of this anastomosis, that's mean joining of these two, is actually a little tricky situation nowadays, because these structures are very minute structures, and whenever we join them together, the chance of getting a near normal value in the summer analysis is quite seldom seen, because even after this anastomosis, we may able to see some sperms in the ejaculate, but it may not be sufficient enough to produce children by the normal route. So that is why this anastomosis has not as less success nowadays. So with the advent of modern assisted reproductive technologies, now standard of treatment, or rather the best option of treatment, will be taking out the sperm from the testicles and utilizing it for ESI and getting the result out of it, because that is more straightforward and has a better answer. But definitely in expertise centers, because in India itself, those doctors who are practicing, or those urologists who's practicing this anastomosis, is actually very seldom. It's because of the advent of more easy procedures like ESI is very freely available. So that option is still available, and those who are definitely needed definitely can consult a doctor and go on it.
Thank you, sir. Thank you, sir, for that nice explanation. Sir, as we have already talked about the anti-cancer medications and everything, that the person who is having a cancer, then we're going to give him the cancer medications which are going to be toxic to his gametes, and the gametes will going to be destroyed. Sir, the term of sperm banking. So can we preserve the sperm to such an extent that a person, adolescent boy who is having this kind of thing, can later on have or be a father of his own child? So sperm banking is feasible. How it is going to affect? Can we have a word, sir, please?
Yeah. Sperm banking is a very common thing which is practiced world over, and it's actually started from the animal husbandry days, and later on it has evolved to the humans. So it has been used for different purposes. One of the purposes is the orthophoresis, that especially when somebody is having malignancy, or they are going for a chemotherapeutic drug or an orchidectomy for that matter, we will be able to get the ejaculate and identify the sperm and freeze it, or we can take the testicular tissue and freeze it. And there are some other aspect. Suppose the husband is staying or working in Middle East, and the wife is undergoing treatment here, and the ratio is not coming. They can give the sample frozen, and later on the treatment can be happen. So this all these things is done by a single entity called sperm freezing. Here, what we do is that we add some cryoprotectant. Cryo means some chemicals which will help to maintain the stability of the spermatozoa even at minus 196 degrees centigrade. That means adding this cryoprotectant into the sperms and mixing it as a coagulant and keeping this in minus 196 degrees centigrade in a media called liquid nitrogen. We will be keeping this sample for the time we keep at that temperature. So there are data even evolving samples retrieving after 20 or 30 years and utilizing for the success. So sperm banking is a very common problem, and it is much used now because the sperm has got a more stability compared with the oocyte and the embryos. So sperm banking is such a fairly common problem and common thing which we practice.
Dr. Raju, there was a movie called Vicky Donor, and I think everybody is aware about that particular entity, and that cleared
Yeah,
the
Vicky
doubt
Donor.
of sperm banking. Vicky Donor.
Yeah,
That's a
yeah,
nice
that's
reference,
We
sir.
have
actually
seen the
something called
movie.
commercial banking, because if it, yeah, then suppose a guy has having no sperms and is not able to retrieve sperm out of his testicles, then the only option for him is to get a sperm from some other individual. For that, there is standard sperm banks. Like blood bank, there's an entity called sperm bank. And now with the new Modi government's rule, there's a bill called ART bill has come. So that there is definite guidelines has been given for this sperm banking facility, and whereby individual can donate the samples for monetary benefit or some part, and these samples can be taken by those who are needy. Like it's similar to some sort of an organ donation or a blood donation. It's a noble cause. So we have to see the good part of also it, as well as there is some witty part also to it.
Sir, Balram sir, can we have some tips to improve the male fertility? Are there any tips or anything like that can we where we can improve the male fertility?
So the good lifestyle is actually the key for good fertility also, because as we were discussing, that the normal fertility can be achieved only in the normal healthy body and with normal hormone milieu, as we just mentioned. So this is true for good fertility also. So maintain good hygiene in the sense of good sleep hygiene. Take proper sleep for 7 to 8 hours. Avoid the stress. Take healthy, fresh, nutritious diet. Stay calm, and don't get so much competitive in the today's era of running, and wear cotton cloths. That is also very important, because as mentioned by Dr. Alpandev, that normal temperature means lower temperature than the body temperature is required for normal sperm production in the testicles, and that's why the nature has decided to keep those in a separate bag. The testicles are in the separate bag just to maintain a lower temperature than the body temperature. So try to avoid those garments which are polyester sort of, or synthetic garments, or they are very much tight. So tight garments might be unhealthy for your sperms or your fertility aspect. Avoid those garments. Stay healthy, maintain regular fitness, regular physical activity, avoid obesity. These all can help you maintaining the normal fertility. So don't worry, friends. Come forward if you have some issues. Then don't shy, don't get hesitant. Come to consult with your endocrinologist, and most of your problems might be sorted out. Thank you.
Arpan sir, I would like to have an important word from you. That young adolescent male, they are usually coming with the phobia, or I should say concern, that they might get a reduction in their fertility potential because of their self gratification or self pleasure kind of activities. If they indulge into these kind of activities, they might lose their fertility. Is there any your words, sir, your suggestions on this part, sir? Is there any such thing?
So, what I understood, I think it reflects the clinical practice. I did see a few people last few years and coming with these concerns at the age of say 18, 20, 22, which are there at least in our society much earlier than we are expected to father a child. But I think this is more common with the girls, with the PCO. Immediately they are concerned, I will conceive or not. That is a different spectrum. But here, for the boys, I think that taking the person into confidence and trying to explain that this is should not be your focus of thinking or something clear. You are normal. You maintain a normal. Dr. Balaram nicely told. Maintain a normal lifestyle, normal activities, sleep a bit early, forget about late night thing, do some exercise, maintain your correct weight for your height, and be a bit healthy and hygienically better placed. That everything should fall out as a normal. I mean, we will be doing, and we will not be doing anything to do a test document. That's very, very important.
Thank you, sir. Thank you for such a nice explanation. So, as we are coming to an end of our session, I would request all the panelists to have their highlight the part on the male infertility where they can summarize and give a word of summary at the last. I'll start with Dr. Balram, sir. Sir, please.
So as I just mentioned, friends, don't hesitate, don't become shy. If you have some issues with the fertility, if you are not able to become parent, then there are various medical advancement available nowadays, available in most of the part of our country. And you please consult your endocrinologist, get properly investigated, and most of your concerns or issues might be addressed properly, and probably you might get rid of your problems. Thank you, Dr. Ronak.
Thanks, sir. Thank you, sir. Sir, Arpan Dev, sir, your concluding remarks about today's session, sir.
I think the way I started, I think I'll tell the same tune that male fertility problem is practical. So we need to remember this and we need to address this. And Dr. Balaram has nicely told that no point in trying to hide something. This is the issue. We want a fruitful outcome. We want a pregnancy. So this is what we need to go ahead. And we are not God that we can treat everybody. But most of the cases, I think we can sort out.
Requesting Raju Nair, sir, for your final words for this session, sir.
Yeah. To sum up, male infertility definitely is a complex event, and there is a lot of treatment available. But my main focus of attention to all the so-called male factor infertility patients is that don't delay treatment, because if you delay treatment, your partner age will get older. So ultimately, the success of any fertility treatment is the female age. So by delaying your problem, you are actually delaying your partner's age. So that will give a more realities to your life. So if you have a problem, treat it early and finish it early. That's the best thing you can do to your family and to your kids.
Thank you, sir. Thank you very much, sir. So I will have the last thing that I would like to add to this is Endocrine Society of India is conducting these kind of awareness seminars, awareness programs on Facebook Live every Saturday, usually from 4:30 p.m. in the evening. So for this month, the topic is men's health. We have discussed the important topic of infertility in males today. And for the next session, we are going to discuss for the next Saturday, we are going to discuss about another topic of men's health, probably on gynecomastia and gonadal dysfunction. So everybody is asked or urged to get tuned into it and watch that session also. Thank you. Thank you very much. Thank you to all the esteemed panelists for being with us and enlightening us, our audience, about these endocrine problems or about the male problem, the taboo of male infertility. Thank you, sir. Thank you very much, Arpandev, sir. Thank you, Balram, sir. Thank you, Raju, sir.
Thank you. Thanks very much, Dr. Mohan Chennai, Dr. Ronak Gandhi, and my co-panelists. Thanks very much. It was very interesting.
Thank you.
Thank you all.